In the course of consulting Kenyans from all walks of life during the formulation of the bottom-up economic transformation agenda, the foundational contribution of health to citizen well-being and the role of costs in driving up poverty were identified as chronic. The implications are very clear, and we cannot afford to delay the delivery of universal health care anymore. Consequently, we have instituted radical reforms in the provision of healthcare services in Kenya, including the enactment of 4 new laws that will anchor the implementation of this bottom-up approach to healthcare. I am tremendously grateful to this House and honorable members for enacting the Primary Health Care Act, the new Social Health Insurance Act, the Digital Health Act, and the Facility Improvement Financing Act. These laws, honorable members, will usher in and guarantee a new era in the provision of healthcare, covering all essential services from preventive, promotive, curative, palliative, and rehabilitative services, guaranteeing every Kenyan access to comprehensive and quality healthcare. Under Afya Nyumbani, we have scaled up our investment in healthcare workforce, employing 20,000 new healthcare workers, deploying 8,429 workers whose contracts had lapsed, and enrolling 3,394 interns across the country to increase the availability of human capital in our public health sector. Working with county governments, and I'm again grateful to them, we have taken measures to resolve the perennial challenge of human resource management in the health sector, occasioning strikes, by establishing the Kenya Health Human Resource Advisory Council, which will be a trusted mediator between government at both levels and our health sector workers. Further, under the Afya Nyumbani model, we identified preventive care as an essential pillar of healthcare service delivery because it enables Kenyans to manage their conditions early enough before they cause serious harm in their well-being and productivity. Community health promotion is our bottom-up intervention to deliver preventive and promotive health solutions at the grassroots by deploying community health promoters to visit Kenyans at their homes, provide basic diagnosis for common conditions, and refer cases to appropriate medical facilities. Together with all the 47 counties, and again, I am grateful to the governors, we have deployed 100,000 community health promoters fully equipped with the necessary kits and an electronic community health information system. In the last 1 month, CHPs have attended to 1.2 million households, just in the last 1 month. I spoke on phone to Mr. Masood Dirie, a community health promoter in Garissa, yesterday, who told me he has been a community health volunteer since 2011. Unlike before, now he has a full medical kit and has used it to confirm that 7 people in his locality had high blood pressure. In a twist of fate, he tested himself and discovered that he too had high blood pressure. That's what he told me. And so, apart from referring others, he also had to make way to the hospital. Mr. Obembi Ogutu of Homa Bay told me that the program now makes primary health care a paperless engagement, saying it had started to reduce queues in hospitals. Through the Facility Improvement Financing Act 2023, we have established a framework that confers financial autonomy to health facilities, enabling them to retain funds generated with a mandate to improve facilities, capacity, and to provide healthcare services within that locality. In addition, the Kenya Medical Supplies Agency, as part of many radical reforms, will now deploy ICT to manage supply chains of essential health products and commodities. As a result of this small intervention, KEMSA has improved its stocking rate from 40% to 60% in the last 5 months. And we are now targeting 80% by March next year.